We've talked about the clinical characteristics, complications, and prognosis of anorexia nervosa, but I do also want to discuss a complication of treatment. This is known as the refeeding syndrome, and it is quite common, particularly in individuals with severe anorexia and very low body mass index who require to be hospitalized and refed in the hospital. So this is primarily characterized by electrolyte and fluid shifts. You get hypophosphatemia, hypokalemia, vitamin deficiencies, congestive heart failure can follow refeeding, muscle breakdown, seizures, and hemolysis. The breakdown of red blood cells can occur during refeeding. The precipitous for all this is hypophosphatemia. So refeeding stimulates insulin secretion from the pancreas. The insulin allows cells to grab glucose, phosphate, and potassium from the serum, but that leads to depleted serum levels of these electrolytes. And mind you, the anorexic already may have a derangement of electrolytes. So this is only making situations worse. So why is phosphate so important? Because it's required for the production of ATP. If the cells get glucose and they don't get the phosphate, then they're not going to be able to metabolize all the nutrients they need, and this will lead to tissue hypoxia. There can be cardiovascular, pulmonary, muscular, and neurologic derangements as a result. Insulin also leads to fluid retention via increasing sodium retention in the kidneys, which can lead to volume overload. So, refeeding syndrome needs to be prevented. Electrolytes need to be corrected before refeeding. There's got to be a slow and gradual increase in caloric and fluid intake. Electrolytes in inpatients need to be monitored closely and repleted because as the patient is fed, serum levels of electrolytes are going to go down. And as I said earlier, depletion of electrolytes leads to the complications of refeeding syndrome. So that's a brief overview of refeeding syndrome, and we'll move on to the next video to discuss other eating disorders.